Hello everyone! Magandang araw po sa inyong lahat. Welcome back to another video from Learner's Path. And today we have a very special guest with us, Dr. JB Sales. Hello po, Doc.
Hello, Z. Good morning.
Yes. And for today, we're going to be comparing and contrasting the courses Pharmacy and Medicine. And we're also going to be diving into how it feels like and the struggles of being first generation students. Doc, could you please do the honors and introduce yourself to us, your educational background, and where you are right now?
Yeah. Hello, Z. Good morning. My name is Jaybie Sales. So I am a first generation registered pharmacist and first one in the family to become a medical doctor in the Philippines. But right now I'm in Canada for vacation. So I finished my bachelor's degree in pharmacy at University of the Philippines, Manila, and had my further studies of medical degree at Far Eastern University, Nicanor Reyes Medical Foundation. I recently passed my physician licensure examination last March 2020. So I am planning to pursue my medical residency, but I'm not yet sure what specialty to take in, but I'm considering anesthesiology or OBGYN.
And at the first place, Paul, what made you want to study the health sciences, or for your case, as bachelor's pharmacy?
Actually, I do not consider the health science courses at first, so during high school days, but rather I consider business courses back then, so especially accountancy. It is my parents who gave me the idea to pursue health science courses, specifically, in my case, pharmacy, and then eventually to continue it further study in medical degree. So on my academic journey, I grew interest in the field, in health science field because of research and also clinical exposure. So for instance, so in my case during my undergrad degree, we had a counseling subject back then. So I had an actual interaction with the patient in the hospital. So I enjoy talking with the patients, giving them information about their disease and also to their medication, as well as giving them advices about their medicine. So I love interacting with different people at the same time doing some research. So here I am, and I am in a health science field.
Yes, health sciences is
Yeah.
filled with talking to other people and also research. I really agree, yes.
Yeah.
And alam ko naman that, it's very different. Everything is different for everyone. But for you personally, which did you prefer? Medicine or pharmacy, and why?
Yeah, for me personally, the level of difficulty and the challenges encountered between these two professions is entirely different. So that's why I do not prefer choosing between the two. So in our country, in the Philippines, so we need to take pre-medicine courses. So in my case, I pursue health science courses, which is the pharmacy. And then after the 4 to 5 year pre-medicine courses, so in pharmacy in UP Manila, we have a 5 year course. And then after that, um, this is the precursor for taking medical degree. So both of these professions, so if you're thinking about the opportunities between these two professions, both of these professions, such as the pharmacy and medicine, had many job opportunities. So it could be in the community, in the hospital, in marketing, in academics, in government, in the private companies, or you can do business.
Mm, okay, yes. And talking about difficulty, about the subjects correlating to medicine and pharmacy, what was the hardest part about studying these two for you?
The hardest part of studying the pharmacy and medicine. So let's first talk about the pharmacy. So I finished my high school in the province and then went back home in Manila to study college. So during my first year in pharmacy, I experienced culture shock. As in, na culture shock talaga ako sa UPM. So in the university, the students there easily grasp and understands the topic easily. And I had a difficulty keeping up with them since I am from a province. So yung teaching sa UP, fast-paced sila compare dun sa province noon. Hindi siya ganun ka-fast-paced. So, talagang na-culture shock ako. Iba talaga. And then, so, to cope up with this difficulty, I did an extra effort to study talaga. So, I did advanced reading for the topic. So how did I know yung topics na aralin ko? So we had a syllabus. So during first day of classes, each subjects will give you a syllabus. So this syllabus will indicate those topics in every meeting. So alam mo na yung topics prior. So before I entered class, so I read the topics na, and then after class, kung natapos na yung discussion, when I get back home, I highlighted the important notes, and then I parang minememorize ko na siya na paunti-unti so that during exams, madali ko na siyang ma-recall. And then, weeks or 2 weeks prior the exam, I did practice exams questions in every chapters of the topic. So, para ma-evaluate ko din if yung way ng pag-aaral ko is effective ba. So, yun yung mga ginawa ko back then nung pharma degree ko. And then, during medicine naman, the hardest part for me back then is the unfamiliarity to the topics in most of the subject in medicine. So since I am the only doctor in the family, so I do not have any idea what medicine is, how difficult medicine is. I don't know most of the topics as well. So since I am a graduate in pharmacy, only topics in related to pharmacy yung medyo nagigets ko at nadadaanan ko. For example, biochemistry, all subjects related to chemistry, pharmacology, or any medicines related na subject. But most of the subjects such as diseases, pathology, anatomy, may mga background lang ako unti-unti as in basic lang. So, what I did back then, yung mga strategies ng pag-aaral ko nung pharmacy ako, hindi na siya effective sa medicine. So, overwhelming talaga sa medicine. And ang ginawa ko back then is to did extra effort, more extra effort ng pag-study ko noon. So, hindi ko kayang basahin lahat, pero as much as I can, as much topics that I can, nagbabasa talaga ako every single time na free ako. For example, maaga ako natapos mag-lunch, kaya maagang nag-dismiss yung professor, o kaya hindi dumating yung professor, yun, nagbabasa talaga ako noon. And then, when I get back home, I read again, kasi it's difficult talaga na first time mong mabasa yung topics, and then nahihirapan kang matandaan yun. So, kailangan ulit-ulit talaga yung pagbabasa. And then, I collaborated with my colleagues. So, to give background in medicine, your classmates will have different professions. So, you will have a classmate na colleagues mo sa medical technologist, pharmacist, nurses, psychologist, PT, and different professions pa, madami. So, if you have friends na or colleagues na graduate or medical technologist, so ask them to help about some topics related to pathology or laboratory interpretation. If you have nurses na friends or colleagues, you can ask about techniques, how to do a physical examination, history taking. If you have physical therapist friends, you can ask them how do they memorize anatomy. They have certain techniques to memorize. So collaborate with them. Yun yung mga ginawa ko noon. Sobrang nahirapan kasi ako.
Super packed schedule and a lot of things to learn, yes. Actually, I know some people, some of my friends in my high school, they don't know which major or career to pick. And some of them, they're picking between continuing with pharmacy or going into medicine. So, what would be your advice for someone who wants to know how to pursue a major or career?
Okay, so if you you are not sure which major do you want to take, so it depends on your interest actually. So you need to think parang 5 years from now, ano yung gusto kong gawin, what I want and love to do. So also be open-minded to the opportunities that the students will encounter. For example, in my case, I like to pursue business courses back then. So since I excel in mathematics and analysis, problem analysis, so I want to pursue accountancy. And also due to exposure, my mom is unregistered accountant. So parang gusto ko yung i-pursue. But then when I am in the field na, I am in medicine, so I am in pharmacy na na
Iba yung
open-minded naman ako, parang na-redirect yung path ko. So parang, oh, maganda rin pala yung medicine. Another factor na um, on how to choose your major career is my NCAA result. So actually, this NCAA result is what my parents, yung binasehan nila kung na yun yung sinuggest nila to pursue health science because yun yung top
mhm,
na result sa akin. So to give background, NCAA result is a national career assessment examination. So this exam, so in the Philippines, this exam was taken by high school graduating students. So during my time, it's fourth year high school. So nowadays we have K-12. So I think grade 10 will have this exam. So the result of the exam will determine your occupational interest for your career,
mhm,
for the career guidance of a certain student. So you need to answer it seriously para pwede mo talaga siyang pagbasehan. And then practically wise, you need to consider also your finances as well because there are programs or courses that are expensive than the others. So for example, health science courses is more expensive than business class. Why? Because in health science, you need to invest to your books, to the laboratory equipments, laboratory materials such as lab coats, and then glasswares, to pharmacy ako. Compare it with accountancy na ang ininvest nila is books lang, wala naman silang equipments and other stuff.
yeah.
Um, and aside from that also you need to look at certain universities also because tuition tuition fee varies in every universities in different courses, so maraming factors na pwede nating tingnan.
Yes.
Mm.
Talking about university, why do you think so many students, especially here in the Philippines, what I see, why do you think so many students do not or cannot pursue higher education, especially health sciences? So, like what you said, once could be finances. What other reasons do you think?
What other reasons I think would be the nowadays kasi in the Philippines we have K-12, so there is additional two courses, I two years in high school, in the high school. So the goal of this K-12 is to make the students competitive to enter the labor workforce so that some of them do not pursue higher education since they have knowledge na and they are qualified to have job na. And then for the students, other students na nag-work, some have work experience and they experience na sumakot na sila. So, they don't think na kailangan pa nila mag-aral kasi nagkakaroon naman na sila ng sahod.
Yeah,
And then also another factor is yung educational background because most of the prestigious universities in the Philippines
yeah.
have entrance exams. So if you had a good background or excellent background during your high school years, so most likely you have a higher chance to pass the
Mm,
entrance exams in the prestigious universities
yes.
in the reputable universities. And also, yeah, another factor, major factor talaga in the Philippines is the financial capabilities of the family.
Yes. And actually, I know some people din yung pumasok sila sa the Big Four, that is UP, Ateneo, De La Salle, UST. They were accepted there, but it's not just because of finances, it's also because the people they have to take care of in the province. So it's not an option for them as well. Yeah. All right, thank you so much, Doc, for being with us today in this coffee chat. I'm sure that those watching have been helped a lot with your valuable advice. And if you guys have any other questions, you can message us in our Instagram for Learner's Path and Learner's Path Philippines. You can also email us. Kahit man kung Tagalog, we can also cater to you. And once again, thank you so much, Doc, for being with us today.